This is Dr. Amin Rmeileh. I'm one of the interventional cardiologists here at Fredo South, and I'm going to talk about cardiovascular diseases for Heart Month, which is February. So, cardiovascular diseases is the most common disease in the world. It affects about 40% of the population in the US, and it involves a multitude of diseases. That includes hypertension, it includes coronary artery disease, heart failure, arrhythmias, and even stroke. So when a patient comes to me and talks about their risk factors and how can I avoid heart disease, we usually talk about modifiable and non-modifiable risk factors. So the modifiable risk factors are like hypertension. We can always adjust our diet or take some medications. High cholesterol is the same. Obesity, losing weight, inactivity, we tell them to stay active. And diabetes, dieting and taking certain medication also helps. And there's the non-modifiable risk factors. We have these set of patients that come in like, well, I never had a problem. Why do I have these problems now? Well, genetics plays a factor. Age plays a factor. We try to tell patients to exercise. That can lower your blood pressure. Also avoid high salt diets. When you lower your salt intake, your blood pressure calms down. So when we talk about the most common cause of death for cardiovascular disease, then we're talking about coronary artery disease, which is 50% of deaths are caused by coronary artery disease, which is basically a blockage in one of the arteries that supply the heart. It goes back to the modifiable and non-modifiable risk factors. There's emergent heart attacks, there are non-emergent heart attacks. But I tell patients, don't ignore any symptoms. If you have any chest pain, chest pressure, seek medical care immediately. You either need an intervention if you have a heart attack, if you come to the hospital, which is called cardiac catheterization, where we do an angiogram. Or if you come to the clinic complaining of some vague symptoms that are chest pressure-like, we do a stress test, which all we can do here at Fredo South. Stroke is a big deal. It's very debilitating. That's also a cardiovascular disease. It involves the arteries. It involves some material, plaque buildup in the arteries, going to the brain, closing an artery and causing a stroke. But slowly we're kind of recognizing that the most common cause of these strokes are atrial fibrillation. So atrial fibrillation is an irregular rhythm. It is more prominent as we age. 1 out of 4 people over the age of 80 has it. So as we age, we're more at risk of having that arrhythmia. A lot of people will end up on blood thinners to prevent a stroke. Basically, the heart beats irregularly, and the blood is not flowing as well as it should, and blood that is not flowing, it just clots. So you need blood thinners. We have an alternative for that as well, which is a left atrial appendage occlusion, which is a new procedure here at Fredo South, where 99% of the clots in atrial fibrillation happen in a little pouch in the left atrium and the heart that we go in there, and we close it in a minimally invasive procedure that lasts less than 60 minutes. And then they can get off the blood thinners, which is very remarkable. I mean, we came a long way. Back in the days, patients were having strokes. Nobody knew why. Now patients are being monitored either with a smartwatch, or when they come to the hospital or the clinic, they get an EKG. They're placed on a telemetry, continuous monitoring, and we detect the atrial fibrillation. So we prevent a lot of these strokes just by correct diagnosis and appropriate treatment. So, under the umbrella of cardiovascular diseases are all these disorders, such as hypertension, coronary artery disease, arrhythmias, atrial fibrillations, and stroke. And we're fortunate here at Fredo South to provide all these services, and we're always available. If you seek another opinion or you need to address a certain issue, we are always available. We're happy to have you, and we enjoy you, and we are able to do everything that is recommended by the American College of Cardiology.